doing nothing may not be an option either. Some patients with migraine, with and without aura, are at increased risk for subclinical lesions in certain brain areas. Subclinical, that means you may not feel weakness in your face, or you may not have a limp, you may not have numbness, but if you can pick this up on functional testing in the brain scan. Also from the British Medical Journal, any history of severe headaches was associated with an increased volume of white matter hyperintensities. They can pick it up on brain imaging. Also, women with migraine have 150% increased stroke risk. Wow, not a good day to be a woman. It does create a problem though. Migraines, and especially in women, result in increased stroke risk. Ultimately, this is brain damage. Doing nothing may not be an option. So what's your focus? Again, we come back to this. Do you want to find the cause? Do you want to correct the cause? Are you willing to change your lifestyle if you need to? Finding the trigger or the cause. From the Journal of Pediatric Neurology, they say long-term prophylactic or preventative drug therapy is appropriate only after exclusion of headache precipitating or causing trigger factors, including dietary factors. And from the Journal of Neurology in year 2000, good management of migraine requires a wellness program that includes regular exercise and rest, good nutrition, and avoidance of headache triggers. Is that what you were told? But the trigger is only part of the cause for any pain condition, whether it be migraine, neck pain, regular headache, back pain. Pain source is usually a combination of causes. The body works as a unit, physically, chemically, and neurologically. Finding the causes and the right combination of solutions requires being thorough. The same treatment doesn't work the same for everyone. So you have to look carefully to find the cause. So what are your causes? Fill out the questionnaire, the risk profile questionnaire on headache, neck pain, and TMJ dysfunction. Find out what your cause is. Here we have an illustration of a piece of wood. Wood you can think of as the body. Symptoms are fire. So if you burn the wood, that would be symptoms. You have a headache or migraine. And matches are the causes or the triggers. The fire, of course, are the symptoms. So if one little match or one little trigger, it may not cause symptoms in the body. The body can handle it. The paper is weakened body. So if you have the body is weakened, its ability to resist, and you have multiple triggers, the result that is likely for you to have serious symptoms. In this case, a headache, neck pain. So combine the knowledge of the multiple causes and solutions for the quickest, most complete, and most lasting results. This combination is called synergy. In this case, it's a positive synergistic effect for the quickest, most complete, and most lasting results. What you eat, drink, breathe, think, sleep, and move all affect your body. They can affect them negatively or positively. Let's make sure we identify these causes and turn them into positive effects. There are 6 synergistic steps to healthy nerves, muscles, and vessels causing head and neck pain. Find the cause, decrease the dietary interference, increase dietary promoters of healthy nerves, muscles, and vessels, move and use your body correctly, supplement as needed, and reevaluate the cause. So find the cause. That's number 1 step. Use the risk profile questionnaire. Use food diaries, elimination reintroduction diets, examinations by qualified people, and lab tests. You may find your solution right at the beginning in the risk profile. You might find the solution through food diaries, finding that one trigger food or combination of trigger foods. You may have to do a more comprehensive elimination reintroduction diet, or you may need some professional help. Number 2 step, decrease dietary interference. Decrease unnecessary medications, decrease caffeine effects and blood sugar highs and lows, food allergies and sensitivities, and generalized toxicity. So unnecessary medication. Many popular medications decrease B2. We heard about amitriptyline. CoQ10, with that one, it's statin medications. Stomach acid, that's your antacids. That decreases your ability to digest. Migraine, plus taking oral contraceptives, increases stroke risk by 800%. That's not a typo. Wow. There's a reference down below in the British Medical Journal. Caffeine effects and blood sugar highs and lows. Taking medication 3 times per week, the medications we talked about before, especially if you're also taking caffeine, can cause headaches. Food allergies and sensitivities. Avoiding food sensitivities allowed 85% of one group to become headache-free. Wow, find that food. Of course, not everyone has a food allergy or sensitivity causing their headache, but if you do, you need to find it. Generalized toxicity. Migraine plus taking oral contraceptives plus smoking showed a 1,000% increase in stroke risk in one study. Also, dysbiosis, which is a bad living environment in your intestines or leaky gut, exposure to toxins, and ability to detoxify. Those are all important. So can your body detoxify even a normal amount of toxins it's exposed to? Increased dietary promoters, minerals, vitamins, essential fatty acids, and blood sugar regulation. Magnesium decreases migraine severity and frequency in some patients. Not all, but if you have a magnesium deficiency, it may be causing your headaches. Vitamins. In one study, 33% fewer headaches with riboflavin supplementation, even at 25 milligrams. Also, patients with vitamin deficiency and headache responded well to supplementation. Essential fatty acids. In one study, there was 65 to 83% reduction in migraine frequency, duration, and severity. And blood sugar regulation. Fasting causes headaches, especially in sensitive people. Move and use your body correctly. Exercise and tissue strength, ergonomics, posture, stress reduction, and muscle and joint biomechanics. Exercise. Strength and coordination is worse in people with chronic neck pain. Ergonomics and posture, including sleep, work, and reading. Proper body use and movement at work reduces head and neck and shoulder pain and needed drug intake by 40% in one study. Stress reduction. In one study, migraines in kids were improved 44 to 67% with stress management, depending on the type of stress management they applied, whether it was in a clinic or at home. And muscle and joint biomechanics. In one study, upper back or thoracic spinal adjustments resulted in very significant decrease in neck pain. So upper back adjustments improve neck pain. We also heard earlier neck pain can cause problems throughout your body. So your whole body works together. There was a 27% more improvement than electrical and heat therapies in this study. Over 6 weeks, in one study, spinal adjustments reduced headache as much as medication, and improvements only lasted in the spinal adjustment group. So they stopped all the intervention, and then they determined how well they did weeks out into the study. There was no treatment, and the people with adjustments continued to be improved. The ones with medications, of course, went back to where they were as far as their symptom profile. Muscle and joint biomechanics again. Here's a migraine patient with dysfunction in the neck joints. The normal curve is 25 to 35 degrees. This patient has a negative 4-degree curve and a 28 millimeter head-forward posture. The red line shows where their curve should be, and you can tell how far off they are from that. And you see the irritation that could occur with disrupted biomechanics in the neck, causing a headache. Now, this is not the cause in everybody, but it's often a cause. Here we see someone's spine before treatment. They had a 3-degree curve. They had neck pain and headache. The red line here is the normal curve. It's 25 to 35 degrees. And then we see after treatment. They had a 17-degree curve and no symptoms. They still didn't have a 25 to 35 degree curve, but it was closer. Their joints were working better, the curve was better, and they didn't have symptoms. Supplement is needed. Step 5. Diet, then balanced supplementation, then targeted supplementation. So diet to include helpful nutrients, you need to establish that as a foundation. And then balanced supplementation. If you don't know exactly what your deficiency is, you shouldn't take high doses of any single nutrient. And then targeted supplementation, based on personal profile or lab values. Healthy nerves, muscles, and vessels to reduce head and neck pain. Now you have the tools to begin. Address your causes, decrease dietary interference, increase dietary promoters, move and use your body correctly, supplement as needed, and reevaluate the cause. Combine the knowledge of multiple causes and solutions. By using dietary, nutritional, lifestyle, and biomechanical treatments, there's up to a 93% chance your headache will hurt less often, or go away completely. If you want help, we provide evaluations, consultations, and treatment. But you have tools to begin with. Start with the risk profile, apply what you know, share it with others, benefit from the knowledge you have. Have a wonderful day.